As California businesses start to reopen, COVID-19 cases are spiking around the country. Is it just a blip, or is this the start of what's being called the second wave?
Speaking to us live right now is UCLA epidemiologist and infectious disease expert, Dr. Anne Rimoin. Good morning, doctor. Thank you so much for joining us.
Good morning. It's nice to be here.
I'm so excited to talk to you because I have a million questions. First of all, I reported on this week as well, and I was shocked when I saw that California this past week broke that record with more than 4,000 COVID-19 cases in one day. So scary. Why do you think this happened?
Well, there are several reasons why this is happening. We're seeing a spike in cases because we're reopening. Transmission of the virus is pretty clear. We know that it's spread person to person, and so as people start going out into the world and start mixing, we're going to see more cases.
Do you think is it demonstrators? Is it businesses reopening? Is it a combination of both?
It's definitely a combination of everything here. As we see businesses reopening, as we see people starting to go out into the world, we're going to see more cases. Of course, it is a question, we probably will be seeing a lot more cases over the next couple of weeks. We've had all of these protests where people have been very close together, some wearing masks, some not. And so I think that as we see populations starting to mix, going out, it's going to be, we're going to see a large number of cases. Now, that said, there are a lot of things that we can do to make sure that we reduce spread of the virus. And the first thing that we can all do is to wear a mask. And our governor just made this, actually put a big emphasis on this. And so it's really important for everybody to do their part, keep their droplets to themselves, wear a mask.
Do you think that the reopening has come too soon? Do you disagree with that? Is that why we're getting into this?
This virus is here, it's circulating, it's going to continue to circulate until we reach a threshold of what we call herd immunity, till somewhere between 60 and 70% of the population has immunity. And that's either going to be from infection or from a vaccine. And because we're far away from a vaccine, this is going to be with us for a while. So the question is, when do we open up? When do we start getting our economy going again? And that is a very delicate balance. There are certain things that can get started. There's certain things that, might be a little bit more dangerous. And just because you can do things doesn't mean you should.
So we heard about what AMC movie theaters did over the past several days. We just heard you say you're recommending everyone wear their mask. First, AMC said they weren't going to require it. Now they're saying they should. It's kind of obvious there, right, what they should do, at least according to your recommendations?
Absolutely. Everyone should wear masks. The science is clear. In the early days, there were a lot of mixed messages about masks. Should I wear a mask? Should I not wear a mask? What kind of mask should I wear? But there is now a lot of scientific evidence, a body of science that really shows that masks do work and that they do prevent this most important way of spreading the virus. And not only do they provide protection, you're doing something to protect other people, but there is some evidence that all masks can provide protection to the wearer as well. So yes, I was really happy to see that the head of AMC walked back on that very surprising decision that they had made that people did not need to wear masks, because a movie theater is a place that's going to be closed in. I mean, it makes perfect sense that people should be wearing masks.
I don't know if I would do it even with a mask, to be really honest. It might be a little too soon for that too. All right, pro sports, let's talk about that. The teams there are developing ways to return without crowds. Some are isolating their teams while others are allowing players to come and go. What do you think about that?
It's really complicated to keep everybody in the same place and doing the right thing all the time. So there's no scenario where you're bringing people together to do something that doesn't have risk involved. And so, I think that you can do the best that you can by quarantining people, testing people regularly, but pro sports are going to be very complicated in terms of being able to keep people safe and to ensure that the virus isn't spreading, because it's not just about these players themselves. It's about the people that are with them, around them.
Right.
Your risk is the same as other people in your household or other people that you're exposed to.
So I'm told to ask you about this second wave, but here in California, did we even really have a first wave? I thought we did a good job sort of flattening the curve.
We've done a terrific job here in California of flattening the curve, but the tricky part is staying there. And then we're not starting to see cases rise here in California, as we will everywhere. A second wave is not something that is a guarantee, but it's something that we are all very concerned about. And the reason that we're concerned about it is we've seen these kinds of waves of infection with other respiratory viruses. But the biggest reason that we've been thinking about this is because of what we saw from the data from the 1918 influenza pandemic. This is not influenza. This is a coronavirus. So we're really not sure how it's going to play out. But what I think the biggest fear is that we're going to see a huge surge of cases in the fall when you see people going back to school, really starting to resume activities. People go more indoors, and so there's more opportunity for spread. And that this kind of an increase in cases could be compounded with flu season starting. So I think that the big concern is seeing a rise in cases, whether it's called a first wave, a second wave, a resurgence, it doesn't really matter. The point is we don't want to see a huge surge in cases and see that come at the same moment that we're seeing a huge increase in influenza, because then we're really going to be concerned about our hospitals being overwhelmed, our health system being overwhelmed, and really trying to sort out what's flu and what's coronavirus.
Hey, Doc, my colleague is much better at keeping her attention, at least than I am. Whose guitars are those?
No, wait, before you do that, I have another question.
Oh, you have another question?
That's okay.
Oh, okay.
That's okay.
Go ask the question.
No.
You
got your KTLA hat? Okay. So go ahead, tell us about the guitars. Oh.
Oh, someone just opened the door. Who's that? Who's that? Come and say hi.
This is a family show.
Exactly.
Okay, thank you so much. It's so great to talk with you. We'll talk with you again, I hope, because there really are so many more questions that we'd love to ask you.
I'm really happy to be here. Everybody, please stay safe, stay well, and have a really good morning.
Yeah,
Cheers.
we're with you right there.
Okay,
yeah.
cheers.
All right.
For more from Dr. Amoyne, you can follow her on Twitter, or you can read about her pandemic response research at the website right there on your screen. All right, don't go away. We'll be right back.